Introduction of National Center for Communicable Diseases. National Center for Communicable Diseases, World Health Organization. The National Center for Infectious Diseases provides national management and professional guidance for the control, prevention, surveillance, and diagnosis of emerging and re-emergent infectious diseases, intestinal infections, airborne infections, tuberculosis, viral hepatitis, sexually transmitted diseases, human immunodeficiency virus, and zoonotic brucellosis. National Center for Communicable Diseases is the organization that meets the requirements and criteria of the International Health Regulations and Asia-Pacific Strategy for Combating Infectious Diseases and promotes scientific and technological progress and sustainable human resource development. Historical Bureau. In 1924, tuberculosis prevention and treatment began. In 1926, Skin and Sexually Transmitted Diseases Prevention and Treatment Ward with 50 beds established. In 1940, established Epidemiology Unit. In 1947, expanded to become Central Communicable Diseases Hospital with 7 wards with 200 beds and 22 medical care services, including bacteriology, biochemistry, sterilization, X-ray, surgery, pathological anatomy, and nursery. In 1961, established bacteriology sector to conduct scientific research. In 1981, expanded to clinical hospital. In 1985, established research department. In 1994, established Center for Communicable Diseases. In 2001, National Center for Communicable Diseases was established to intensify and to improve the fight against communicable diseases in Mongolia. Mongolia in terms of immunization. In 1965, introduced oral polio vaccine. Since 1987, created first immunization schedule that adapted to Mongolian condition. It was subsequently updated in 1993, 2002, 2006, 2009. At present, children under 15 years old are routinely vaccinated with 8 types of vaccines against 12 communicable diseases. As results, diphtheria and pertussis has not been reported in the last 18 years. Mumps is 0.1 cases per 10,000 population. Viral hepatitis B is 0.2 cases per 10,000 population. Tuberculosis decreased to 6.9 cases per 10,000 population. Scheduled vaccine coverage is more than 95% since the approval of the law on immunization in 2000. Received polio eradication certificate from World Health Organization in 2000. In 2005, a meningitis vaccine was introduced against the Haemophilus influenza type B. No cases of meningitis caused by this bacterium have been reported in 2021. In 2012, introduction of scheduled hepatitis A vaccine as a result of the incidence of the diseases dropped by 99 times. In 2016, the 13th pneumococcal vaccines was gradually introduced, and it was introduced at the national level from 2019. As a result, pulmonary pneumonia decreased 26%, severe pneumonia decreased by 42%, and most serious pneumonia decreased by 46%. Since 2021, the fourth in human papillomavirus vaccine has been introduced for voluntary immunization. In 2021, the establishment of the Vaccine and Biopreparation Center has increased the capacity of the warehouse by 3 to 4 times. Started to register people vaccinated against COVID-19 in the health.gov.mn-VAC electronic vaccination registration program. Based on the electronic registration information, we provided regular COVID-19 recommendations and timing for the next dose to each person by phone. Communicable diseases outbreak response. In 2003, worldwide new outbreak and 9 people were infected by the acute respiratory syndrome. As a result of good surveillance and response activities, the infection did not spread further. In 2019, the pandemic caused by the H1N1 virus was reported in Mongolia. A total of 1,505 people were infected, implemented multisectoral joint response activities. Between 2005 and 2016, a measles outbreak was reported and about 56,000 people were infected. NCCD successfully provided professional guidance and conducted surveillance activities, provided immunization, laboratory diagnosis, and medical care services to the local health centers. STI, AIDS, HIV care service. Measures taken in other communicable diseases. Sexually transmitted diseases, AIDS and HIV care service. In the 30 years since the first case of HIV was reported in Mongolia, the prevalence has been kept at less than 0.1% through well-planned responses supported by the World Health Organization and Global Fund to fight against AIDS, tuberculosis, and malaria, as well as international organizations. No cases of mother-to-child transmission of HIV, no medical-related causes, and no blood-to-blood transmission were reported. Field epidemiology training. Introduction of field epidemiology training in Mongolia since 2009. A total of 84 doctors and medical professionals were trained within 11 nationwide trainings. We have responded to 43 national outbreaks since the establishment of the Field Epidemiology Department. 33 tuberculosis dispensaries provide integrated system care services nationwide by using Gene Expert and digital X-ray devices. Healthy Liver Nationwide program implemented between 2017 till 2020. By 2021, the program has screened 1,180,000 people for hepatitis B and hepatitis C, 7.8% with HBV and 9.3% with HCV, and 41% were treated. Developed a guideline on triple elimination of mother-to-child transmission of HIV, syphilis, and hepatitis B virus, and it was approved by ministerial order and implemented nationwide. At the national level, hepatitis B immunoglobulin has been ordered based on the requirements and distributed to health facilities and provided professional guidance. Mongolian response to COVID-19 pandemic. Cross-sectoral organizations conducted joint risk assessment to ensure pandemic preparedness and response. The first transported case in Mongolia was on March 8, 2020. The first case of domestic infection was reported officially on November 11, 2020. More than 950,000 cases of COVID-19 officially reported in Mongolia by June 5, 2022. 1,235 people lost lives due to COVID-19 infection, and the case fatality rate is 0.22. Achievements. At the beginning of the pandemic, 4 laboratories were performing real-time PCR tests at the National Center for Communicable Diseases, the National Center for Zoonotic Diseases, and National Institute of Public Health. As of today, a total of 57 laboratories are conducting real-time PCR tests at the UB city and provincial levels. Introduced multiple diagnosis to the SARS-CoV-2 diagnosis and using real-time polymerase chain reaction analysis. In January 2022, NGC technology was introduced in the country, and 659 samples of variant surveillance were successfully tested for nucleotides of the whole genome analysis. Previously, it was used to send to abroad for the NGS analysis. Current COVID-19 vaccination coverage. Dose 1 coverage is 69.6%, Dose 2 coverage is 66.9%, and Dose 3 coverage is 32.2%. In 2021, a total of 9,253 people were infected with COVID-19, were hospitalized at the NCCD. Provided antiretroviral therapy to the people living with HIV/AIDS at their home. Patients received follow-up and other tests based on their needs during the strict quarantine of the COVID-19 pandemic. In addition, a Call Pro telephone counseling service was introduced to provide STI, HIV, and AIDS prevention information to the population. Tuberculosis treatment was monitored using the remote monitoring methods, video, DAR, telephone, internet. Volunteers and physicians also visited patients' homes to monitor treatment, dispense medications, and to collect and transport samples as needed and provided uninterrupted care. Our further activities. According to the World Health Organization, recommendations for response to the COVID-19 pandemic in the Asia-Pacific region. To immunize people who have not been vaccinated against COVID-19. To plan public health goals and social response planning. To strengthen and to protect healthcare system. To introduce early detection and target response. To coordinate border response in accordance with the situation. According to above-mentioned 5 directions, we are working to develop a national implementation plan to determine the policy direction of the surveillance, risk communication, and expanded contact tracing activities.